Well, the pandemic might make it tempting to postpone your routine checkups, but USA Health's Mitchell Cancer Institute says women should continue with those regular screenings, and especially for cervical cancer. Joining me now with more on this is Dr. Jennifer Young-Pierce, lead of cancer and control prevention at the Mitchell Cancer Institute. It is so nice to have you with us.
Thank you so much for having me.
So we are talking about cervical cancer, and for those who don't know, explain what that is.
So the cervix is the opening to the uterus. You can see it just at the top of the vagina. And every woman has a cervix. It is a place that unfortunately is very vulnerable to cancer, like the other points of entrance to our body.
And which individuals are more at risk, and what are the symptoms?
Unfortunately, cervical cancer often doesn't have symptoms in the pre-invasive and early cancer stages. For women who have symptoms of cervical cancer, often it's very advanced. So what we ask women to do is to keep their screenings on time to catch those asymptomatic lesions. But symptoms of cervical cancer can include irregular or abnormal bleeding, postmenopausal bleeding, pelvic pain, or a discharge that's unexplained.
Wow, so what about the treatments that are available right now?
So for cervical cancer treatments, the best treatment, of course, is prevention, because then we can do very small office-based procedures to remove abnormal cells of precancerous cells. But if we get to the actual cancer stages, unfortunately, most women lose their fertility as part of a cancer treatment, whether that's through hysterectomy, radical hysterectomy with removal of lymph nodes and things, or even radiation and chemotherapy treatment. Unfortunately, some women are diagnosed with cervical cancer when it's already stage 4, and the treatments at that time are very limited.
So you are wearing teal, and that is the color to remind people to know more so you can do more. What else can we do to make sure that women are getting those exams?
Absolutely. When we see pink in October, we think about mammograms and breast cancer, and we want you to know that when you see teal and white in January, to think about your Pap test and make a plan this year for how you're going to get screened for cervical cancer. For those of you who are parents of adolescents or young adults, and even adults yourself, we also want you to make a plan this year to get your HPV vaccine. We've been talking a lot about COVID vaccination, and of course that's very important to protect yourself from the COVID virus. Very similarly, adolescents starting as young as 9 all the way up to adults age 45 can be vaccinated to prevent the passing of HPV, human papillomavirus, that causes cervical cancer, and therefore be protected from both cervical cancer as well as 6 other HPV-related cancers, including cancers in men. So we really want people to think about their cervical cancer screening, but also vaccination.
And really quick, because we're almost out of time, but I know that you have a very special podcast episode that you wanted to talk about to continue this conversation.
Absolutely. Season 2 of our Cancering Show podcast is coming up. We hope you'll catch it and learn more about ovarian cancer prevention and health disparities. We look forward to seeing you on the show.
Always a treat to have you with us. Thank you so much for stopping by.
Thanks so much for having me.
And you can watch this interview again or share it with someone you know. Look for it shortly on our YouTube channel. We'll try to get it posted for you right after this newscast. And make sure you subscribe. You click that little bell, that little icon there, and that way you never miss an alert when we post something new.